Good morning, and for those listening elsewhere across the globe, good afternoon and good evening. We're just letting a few people in for this very, very exciting ecosystem. We'll talk more about that in a second, but I'm just going to let a few people come through the door because these things happen a little bit slower than they used to. Welcome to those people who are joining us from across the globe. I can see colleagues here already, including colleagues from Australia. So welcome to our ambassador, George Margelis. Hope you're okay, George. A long time no see. And colleagues coming in slowly. So my name's Andy Bleeden. Welcome to this digital health and data thematic innovation ecosystem. This is one of our thematic ecosystems that we're doing in partnership with the Digital Health Uptake Project, which is funded by Horizon. And we're proud to bring this together with colleagues from our VELES project, which we'll hear more about later on. But for those people who don't know about ECH Alliance, who've never been involved with these, and don't know anything about either the Digital Health Uptake Project or ecosystems, let me just help you out. My name's Andy Bleed. As I said, I work with the ECH Alliance as a communities director, so working with our members and our ecosystems. We're a member organisation, okay? What we do as a member, you can see in front of you here, okay? We have around 1,100 members across the globe, organisations, not individuals. Most of those are not-for-profit organisations, research organisations, some of which are here today, networks and associations, so have joined the call, but also hospitals, government bodies, patient organisations, companies, funders, etc. And we bring all those together in a network of ecosystems. I'll tell you more about those in a moment. We do 4 things with our members. Firstly, we connect them together. We convene them together in sessions like this to bring about best practice, showcase needs and solutions in this area around data and digital. And then lastly, we also both amplify what our members do and accelerate what they do, using that network, that infrastructure network of 80-odd ecosystems. When I talk about ecosystems, I'm not going to go into the theory of this. It's a really basic model. The idea is around matching need and solution, breaking down silos in permanent multi-stakeholder gatherings, bringing all the stakeholders of health together on different topics, whether it's diabetes, dementia, AI in health, falls prevention, or here, looking at health and health data in depth. We can do this both in a vertical way in a geographic region, such as maybe Greece or Romania. We're hearing from some of those partners today, but also cross-border. Because why wouldn't we do that and start reinventing the wheel? One of those particular diseases we suffer with in health. And so our ecosystems are there to break down silos, transform healthcare, do stuff. Hopefully that doesn't need any further explanation, but also create economic growth. That network of ecosystems is very, very much now global. So you see some of those ecosystems here. This is already out of date, but we've just welcomed in ecosystems from Singapore, Switzerland, Los Angeles. Shortly, we'll be welcoming more ecosystems from the rest of Europe and also Africa. We use this as an infrastructure to implement, to land organizations in different countries and to collaborate. We see this as a permanent basis by which we can share best practice and also, as I said just now, stop reinventing the wheel. And by sharing practice from different countries, we can usually see where there are similarities. We always look for differences, but the key to collaboration is to see where there are similarities where people can collaborate. And we use a network of thematic ecosystems, of which this is one, based on either mental health, telemedicine, or integrated care. This year specifically, we're really targeting down on women's health, healthy aging, and digital health and data. And what we're looking to do today is, with our colleagues from the Digital Health Uptake Project, as I said, funded from the Horizon program, is look to see where we can bring about best practice, not just from the ECH Alliance as such, but to say what is happening in Greece, what's happening in Romania, what's happening in Cyprus, and wider across Europe. That's enough from me. Not for the first time, I'm sure you've heard me say that. I'm going to hand over to my colleague, Angelina. Angelina, please introduce yourself.
Thank you, Andy. Esteemed audience, welcome to our ecosystem gathering. My name is Angelina Kurubali. I am a scientific coordinator of the Hellenic Digital Health Cluster and a researcher at the Institute of Computer Science at Forth in Greece. I would like to thank very much the ECH Alliance and the project Digital Health Uptake for giving us today the opportunity to present our experiences with building health data spaces within the VELES Excellence Hub, which is doing a lot to advance health data spaces for digital health solutions. But what are the health data spaces that we're talking about and we hear very much currently, and why are they important? In April 2024, members of the European Parliament voted in favor to approve the interinstitutional agreement on establishing a European health data space, a health ecosystem with specific rules, common standards, and common practices, as well as infrastructures and governance frameworks, in order to do what? In order to empower individuals to take control of their health and health data and facilitate the exchange of their data for the delivery of healthcare across Europe. This is a unique opportunity because it will help to foster a genuine single market for electronic health records, but also to provide consistent, trustworthy, and efficient systems in order to reuse health data for research, for innovation, the industry, for policy making, and for regulatory activities. So we are in a very optimistic time at the moment, but a lot needs to be done. So the European health data spaces will enable the EU to fully benefit from the potential offered by safe and secure exchange. But how will this happen? VELES is a project, Excellence Hub, which is pioneering the European health data spaces by building the first regional health data spaces. And this will bring us to our distinguished speakers today that will give us much more detail about these actions. And we will hear from Georgi Petkov, health care lead at the Gate Institute in Bulgaria. We will hear from Dimitris Katechakis, director of the Hellenic Digital Health Cluster and head of the Center for E-Health Applications and Services at Forth in Greece. We will hear from Carmen Mihai, cluster manager of Imago Mall in Romania, from Marius Neophytou, senior officer at the National Electronic Health Authority in Cyprus. And we will hear also from Olga Galanets, senior project manager at the International Data Space. And without any further delay, I would like to pass the floor to Georgi. Please share your screen. I would like to keep the times so that we can have some time for discussion at the end of our session. Thank you all for being here.
Okay. Hello, my name is Georgi Petkov, and I'm a principal investigator in the healthcare direction in the Gate Institute in Bulgaria. So I would like to do a really brief overview of the VELES project, but yeah, this it was already introduced with the main parts, but it's Horizon project, which started the 1st of June, duration of 4 years, and contains 15 partners from 7 EU countries. Which are those countries? These are the widening countries like Romania, Bulgaria, Greece, and Cyprus, plus 3 supervising countries. These are Sweden, Germany, and Spain. These are the objectives. It was already set that our 4 countries, Bulgaria, Cyprus, Greece, and Romania, are a little bit lagging behind the other European countries in terms of digitalization. And this is the reason why the project started, the primary reason. And we have current regulations, okay, but without specific application practices. We are growing our innovation potential in the healthcare domain. Again, the specific policy instruments are missing, still are missing on some places. And of course, the work with the business, the companies which are interested in this area, and different funding mechanisms. So this was the objectives and challenging be in front of the VELES project. Of course, we have our great opportunities, as was said before, that European Union is creating European health data space, and this is one of the main priorities until 2025, which gives a lot of opportunities for business, for research, and everything. This is in a favor of patient, finally. So what I could say more, the vision is, okay, we would like to accelerate innovation excellence in our 4 countries, facilitated by advanced partners. VELES creates a sustainable, place-based innovation ecosystem. This is very important. And also regional smart health data space. This means our goal is to go to a regional level and share data for different purposes, but on the first place for scientific use in and innovations in the medical healthcare sector. Okay, what are the expected outcomes from the VELES project? Of course, excellent and sustainable smart health place-based innovation ecosystem. This is very important. Of course, we would like to have a common strategy for establishing cross-border regional smart data space. We need to prepare 4 pilots with minimal viable smart data health data spaces, and of course the long-term strategic agenda and transformational framework in the area. Of course, this includes common investment plans for infrastructure, national, regional, and future European funds, as well as private capital in a synergetic manner, and of course, learning curriculum for the business users. Now, with few words, I will present our pilot project, which is connected with Alzheimer's disease. The idea of our project was that the large-scale brain networks in Alzheimer's disease, they're keeping the whole information about the disease. So the only way, the only problem is to find a way to encode it. So we did a small feasibility study with several patients, several controls, and several people with mild cognitive impairments in order to proof of the concept of our idea. Our idea is very simple because the how to say necessary and sufficient condition for a person to be diagnosed with Alzheimer's disease is to have completed cognitive test and to have a EEG recording, which are showing that this could be classified as a patient or not. Okay, so we decided to use these 2 points, and getting the proper segments from the EEG recording of the patient and of the people in general before we know that they will become patient or not. To use the synchronization model in order to reconstruct the functional brain networks of the brain, and then to use network measures and network analysis to get the results. So to make a classifier which with a very standard test, e.g., which is non-invasive and cheap test, we can separate the healthy people from patient. How this looks in the data space. Now, in this general schema, you can see on the left side, this is the description of the connector. It connects data owner through the data provider with the connector of the data space. We could have many of those connectors connected to different hospitals, and also we'll try to establish a regional cross-border data space. This means we could have a connector to cross-border data. Then all those things are in one space and they can exchange and process the data. And on the right side, you see our algorithm, which will be processed here. Of course, another benefit of working with the data space is that part of the processing, especially all the learning algorithms, can be done on place directly through the connector. It's not necessary to transfer data to the data space. In general, what we are gaining having a data space, first, very easy share data, and on the second place, we are showing the concept pay as you go. So we are exactly paying for what we would like to achieve, not to lose a lot of time and resources to prepare a really huge and really detailed database. Okay, here are the description of the participants in the feasibility study. You see 26 healthy, 25 people with mild cognitive impairment, and 22 with Alzheimer's disease. And also the results of mini mental state examination test are here, so they are matched totally. We do two analysis, spectral analysis and network analysis. As you see here, the spectral analysis at about between 2 and 5 hertz shows a very good differences with everyone can see the really low p-values, which is good, between the normally aging people, which are marked as old, and Alzheimer's disease, which are people already diagnosed, which are marked with AD. Unfortunately, it's not clear separation with people with mild cognitive impairments. Then we are coming to network measures. Different network measures in different frequency ranges also can distinguish between the people with Alzheimer and people normally aging people. And something more, we built here the ROC curve of the process, and we see that the area under the curve is almost 90%, which is very good result, especially for a feasibility study. And then we try something more specific and more valuable as a result if we can achieve it, and you can see this here. So because we use for this study old data from, let's say, more than 10 years ago, and we know that after 8 years, some of the people with mild cognitive impairments, they become Alzheimer patient, and some of them, they stay stable. So we broke the middle group of mild cognitive impairments people into individuals, not as a compact group, but taken like individuals. They were absolutely perfectly classified. All the people who are later on they become patient of Alzheimer, we classify them that they will become a patient, and we classify the rest that they will not become the patients, which means that one of the possible how to say big benefits of this study is that this study could be used as a basis of screening program in the country, and based on this to predict who will become a patient. So we have continuation step. I don't want to lose more time because it was a bit longer presentation. Thank you very much for the attention.
Thank you very much. As you saw, we can go very deeply into using data and having benefit for the patients and the whole healthcare system. And I would like to ask Dimitrios Katechakis to share his presentation and continue to see what is happening in Greece.
First of all, I'd like to ask you whether you hear me and whether you see my screen.
Perfect.
Yes, very well.
Okay.
Thank you.
Okay, so good morning to all, and thank you for the invitation to be here with you today. Before I begin, I'd like to say a few words about the Hellenic Digital Health Cluster, or HDHC. HDHC was established in 2021 as an initiative of Fourth Foundation for Research and Technology, Hellas, and focuses on the further development of the most important entities active in the field of digital health in Greece, as well as the strengthening of their innovation capabilities. It does so by providing consultation to Greek businesses active in the area of digital health services, and through its involvement in projects relevant to the development of advanced digital skills and the digitalization of businesses and public services. Focus areas of high values to its members include the health data management and, of course, the creation of telemedicine solutions. Since its establishment, it has developed a broad network of partners and collaborators, of course, throughout Europe, including the European Connected Health Alliance. Members come mainly from the private sector and include hospitals, IT vendors, spin-offs, innovation parks, legal firms, insurance brokers, competence centers, health associations, municipality enterprises, health technology assessment consultants, research centers, and startups, amongst others. Now, regarding the situation in Greece. As you can see from in this slide, Greece counts for around 2.5% of the European Union population, with a higher share of population over 65 than the EU average. Although spending on prevention has grown at 4% of health expenditure, it is still low compared to the EU average, and resources dedicated to long-term care are among the lowest in the European Union. In addition, although the numbers of medical graduates are growing, as you can see in this figure in the middle, they still remain below the EU average. Clearly, in the country, there is a huge demand to quickly introduce new technologies across health services to improve patient care and increase operational efficiencies, something which is crucial for the sustainability of the health care system in the country. Today, more than 120 digital services for citizens, professionals, and public administration are accessible online under the health and welfare section of the gov.gr web portal, which was introduced in the country in 2020. Now, it is indeed a fact that the pandemic crisis accelerated the implementation of projects that were needed for decades within the national health system. Today, the main sources of digital health data in Greece are the Ministry of Health, the e-Health, the e-Government Center for Social Security, the National Organization for Healthcare Services Provision, all the private and public hospitals of the country, diagnostic centers, and research programs. Although significant progress has been made in linking hospitals, regional health authorities, and primary care, there is still no unified access to all EHRs at a national level. What's expected to shape usable data sources in the next few years is the recovery and resilience plan projects, such as the ones you see here for the development of a national EHR, the improvement of the digital readiness of hospitals, and the introduction of an integrated care system for oncology and hematology patients, which is expected to introduce the first cancer registry in the country. Also, EU funding projects for digital transformation. These mainly focus towards standardizing quality health data exchange within the European Union and associated countries as part, more or less, and these projects are connected to the My Data and the My Health at EU initiatives. Also, there are some relevant national and European flagship initiatives, such as the ones for precision medicine and the Cancer Imaging Archive, as well as the European Digital Innovation Hubs that already provide significant guidance to SMEs and PSOs. PSOs is public service organizations. Additionally, Greece has participated and still participates in emblematic EU initiatives and networks that have assisted in the development of significant national research infrastructures, such as Elixir, bioimaging, BBMRI, and others. Now, regarding the analysis that we have conducted as part of the VELES Excellence Network. The Hellenic place-based ecosystem has several good practices to demonstrate, such as the National Electronic Prescription System, the COVID-19 Patient Registry, the Personal Health Insurance Record, and the My Health mobile app. All these are functional services widely used in the country. Still, no coherent framework to support data sharing within the entire data ecosystem is present. Strengths of our ecosystem in the country include the existence of significant data repositories, ongoing projects, and centers of excellence. Opportunities are centered around the European health data space regulation, and of course the significant funding that is available that can assist in further development of the overall initiative. But there are certain weaknesses that need to be cured that include data fragmentation, lack of agreed quality indicators, and absence of open processes for accessing anonymized datasets. Threats are mostly centered around the feeling of mistrust to the use of data and the lack of incentives in both recording and also using data at the end of the day. The expectations in the country in regards to data spaces are that data spaces expectations are for data spaces to be structured environments that will enable the secure and compliant exchange of data assets, ensuring fairness for all participants within a data sharing ecosystem. This is, of course, our expectation. Advantages such as the empowerment of individuals and that data use facilitate research, innovation, policy making, and regulatory activities are quite well understood under certain preconditions, of course. Still, enhanced commitment, awareness, and collaboration are still needed. So there needs still some effort to be put on that. In VELES, and I will conclude my presentation with that, Greece has undertaken the responsibility to develop a pilot study on cancer treatment. We plan tackling in this pilot study the verification of multimodal cancer data for the development of AI models and decision support tools through the development of a data innovation canvas, since the development of effective decision support tools for AI models for cancer management and prediction requires access to large datasets that encompass complex data types. Our aim in this network is to support efficient planning and decision making in cancer care that will lead to personalized prevention and treatment, and of course support patient needs and the sustainability of cancer care. Members of our cluster are already involved in the process of developing the study, which we plan to deliver as work within VELES progresses, and this is work scheduled to be delivered within the next 3 years. So, having said that, I thank you for giving me the opportunity. I would be more than happy to answer any question that you might have.
Thank you, Dimitris. Then we move to our next presentation, and I would like to ask Carmen to share her screen.
Thank you
And,
very
let
much,
us know
Angelina.
what's going on in Romania.
Yeah, thank you very much, Angelina. I hope you can hear and see me.
Yes.
Just a second to share my screen. Yeah. So once again, I'm happy to be here with you.
Carmen, we see the regular mode, now the presentation mode. Excellent.
Now
Thank
it's
you.
okay.
Yes.
Yeah.
Yes.
So thank you very much once again, and I'm happy to be here to present what's happening in Romania and especially what we are doing in such an ambitious project as VELES it is. So just a few things about the Imago Mall cluster. We are a medical cluster set up in 2012 as a result of an FP7 project. We are, of course, a non-profit and non-governmental organization. Currently, we are a gold labeled cluster, and our main focus is on medical and nuclear imaging, as we have the title including these keywords, but we are also moving a lot towards precision medicine, digital health, and supporting the embrace of artificial intelligence in healthcare. We are members in member of some alliances and sound alliances and networks. We are currently coordinating the meta cluster in precision medicine. We are member of Vanguard Initiative and Smart Specialization Strategy platform with the support of our founding member, Northeast Regional Development Agency of Romania. Of course, we are a member of ECH Alliance, CBER, Council of Europe bioregions, also member of Eureka, and as also my Greek colleague mentioned, the Digital Innovation Hubs from Europe. We are member of the Digital Innovation Zone, the European Digital Innovation Hub of the Northeast region of Romania. Currently, we have 71 members, of course, covering the whole quadruple helix, including here universities, hospitals, healthcare providers, public authorities, associations, innovation associations, patients associations, facilitators such as the Northeast Regional Development Agency, as mentioned before, as a founding member, and of course a lot of SMEs and startups, both medical and tech companies. Moving towards the topic of our discussion, here you can see a snapshot of the work we have done under VELES project in order to map what's happening in Romania in terms of advancing towards the implementation of health data spaces. So here you can have an, let's say, a kind of a table, including the good points and the pain points in relation with the implementation of digitalization in Romania. So what is good is that at the national level, we have a wide variety of digital systems for the collection of the primary data, including here a national platform for the health data, including the health card, also the electronic prescription, and also the patient electronic file. Unfortunately, of course, these platforms are quite old and they need investment for their upgrading. So now in Romania, there of course there is also the national recovery and resilience plan going, and a lot of funds are going towards exactly reinforcing these platforms. Also in public hospitals and also in private hospitals, private medical institutions, we have various medical software applications, but unfortunately, communication is still done using email or another communication channels or platforms such as WhatsApp. So we have a lot of disparities in the level of digitalization of these entities. In terms of the legal framework, we have, of course, a lot of legal documents in place, but there are some deficiency in terms of the need of the different aspects regulated by the laws. So we need the harmonization and explicitly provide the necessity of the interoperability of the systems. So again, in terms of governance framework, we need a more transparent and well-defined governance framework. In terms of standardization of the data, currently the Ministry of the Health in Romania is trying to standardize the codification of the data, but in order to eliminate this problem of the absence of standardized protocols in the acquisition and storage of the medical health data. What we also see that there is an insufficient digital literacy among the healthcare professionals and also, of course, among the patients. And sometimes it's also a lack of interest in embracing digitalization among the tech providers, I mean the software providers. I don't know if it's moving. Okay. In referring to the good practices, what we can say that in Romania we have joined the European initiative 1 plus million genomes, which is a very good thing, because this initiative aims to enable unfederated access to the relevant genomic and clinical medical data across the EU. And in this respect, we have developed a strategic project at the national level called the Development of Genomic Research in Romania. And in 2000, exactly right, this year, in 2024, we have integrated the project in the genomic data big project. Also, another good practice is the National Electronic Vaccine Record. This record is managed by the National Institute of Public Health, to the National Center for Surveillance and Control of Communicable Diseases. Also, another thing to outline is the fact that Romania is the only European country that has a law dedicated to personalized medicine. So the law explicitly describes the right of the people to have a personalized medicine. And as mentioned before, we have this great expectation from the National Recovery and the Resilience Plan to infuse large amounts of money in the digitalization of the healthcare system. So around 400 million will be is available, and currently there are a lot of projects implemented under this program in order to support the digitalization in healthcare. As mentioned also by Dimitrios, we have performed under the VELES project a SWOT analysis, and here you can have the map of this SWOT analysis. I won't go through all the items because some of them I have already presented. So in terms of strengths, of course, in terms of technical infrastructure, we have providers that are integrating digital system in order to collect the patient data, and a lot of tech providers which are offering this kind of this software. In terms of data readiness, we have really good functional data registries, such as the vaccine one that I have already mentioned, and we have also rare diseases registry, which is working very well. So we have a good practice in this respect, and also some good practices in relation with medical imaging. For the legal and regulatory point of view, of course, we have laws and strategies. Unfortunately, the e-health strategy, which has been started last year to be discussed, is yet not released. So we really need this e-health strategy to be open for us, for our ecosystems in Romania. Of course, this is the job of the Ministry of Health. And in terms of stakeholders, we have a lot of stakeholders to rely on. Of course, the weaknesses are also the technical infrastructure, which is also is a great need to be renowned, and in order to have a really good patient journey monitoring. For the data readiness, we have, unfortunately, a disconnection between the public and private healthcare. So we cannot yet ensure interoperability. And of course, the disparities in the way of acquiring and storage the data, so in terms of the data formats. For the human resources, we have a shortage in the terms of the specialized personnel for the health data management. And for the legal and regulatory point of view, I have already mentioned the need for the harmonization of the legislation. For the opportunities, we have this National Recovery and Resilience Plan, which is much weighted for all of us. Also, the development of a future national observatory for health data is also very promising for us. For human resources, there are some planned investments in the IT infrastructure, and aligned with these investments in IT infrastructures of the hospital, a proper training for the personnel. And in terms of threats, of course, if we do investments in healthcare infrastructure, we have to do it wisely. We have to do it to be interoperable. So this is a threat we have identified as a threat. Of course, in terms of let's go to the stakeholders. It will be an increased volume and complex health data. So this would be somehow an overwhelming duty for the healthcare providers. So we have to build the trust in this respect, and to give them all the tools they will need. Going back to the project and what VELES is proposing, yes, I will end right now.
Great, thank you, because
Yes,
we
I
would
will.
like to have some time for discussion.
This is just yes. This is just what we were proposing for VELES project as a pilot. Is that the pilot on cerebral tumors for the Northeast region part of the country? It's also for the secondary use for research purpose. So, of course, we'll keep you updated in other meetings with the progress on our pilot. So thank you very much, and sorry for being too long.
No, thank you. Thank you so much. Let's go to Mario Zofitou, and we will hear about Cyprus this time.
Yeah.
I would like to
Good
ask
morning.
you to keep the time so
Yeah,
that we can
course.
continue
All
with the discussion. Thank you.
Thank you, Angelica. So good morning, my name is Mario Zofitou. I'm a senior officer at the National Health Authority of Cyprus, and my presentation is about the electronic health ecosystem in Cyprus. The National Health Authority was established in 2019, supported the National e-health law. Based on the e-health law, the National Health Authority will implement the single bank of electronic health record, which we hope to be available for all Cypriots citizens by the end of 2025. By creating the integrated electronic health record, all the citizens will have access to control their own health data, while excellent quality collected data will be a treasure trove for scientists, researchers towards gaining more knowledge about diseases. The integrated electronic health record can benefit citizens not only in their residential country, but across the European Union, supporting the national contact point for e-health for cross-border e-health services, healthcare services. So, COVID pandemic motivated member states to collaborate in order to overcome any gaps related to public health. After the pandemic, the states made a great effort to achieve complete the European health data space. So the European Parliament approved the creation of the European health data space in 24 of April 2024. And there is a huge potential to use health data to gain more knowledge. This new framework intends to make it easier for individuals, doctors, researchers, regulators to access and use information about the health for EU citizens. There is an alignment between the articles in the European health data space and the e-health law, our law. As you can see, the Article 6 refers to functions performed in the European health data space. Article 16 in the e-health law corresponds to Article 6, referring to interoperability with other e-health systems. Also, Article 10 in the European health data space ensures the implementation at national level of the European electronic health record exchange format in collaboration with national authorities and stakeholders. So Article 17 in the e-health law is aligned to the European health data space by issuing guidelines regarding the e-health application, certification, framework, etc. Finally, in the Article 3 of the European health data space seeks to provide significant safeguards at both union and national level to ensure a high degree of data protection, security, confidentiality, and ethical use. Based on our e-health law, Article 17, which is aligned with the Article 3 at the European health data space, we can ensure that data received are secure. And also, building the European data space will require significant development work for member states, for organizations, etc. So as data controllers, the National Health Authority is obligated to apply the legislation across the country and eventually comply with the European data space regulation. As an e-health authority, we're currently participating in 9 European e-health related projects, and we're coordinating the joint action extended EHR for primary use of health data, which is very important to follow up the European data space and to make the base for the next step in European Union. Furthermore, the NEHA will be the health data access body for Cyprus based on the EHDS regulation. And there's no doubt that VELES drives through the European data space by enabling the development of a regional smart health data space. So it's very, very important to continue our work and to disseminate actually the results of the VELES project. So I was very short, Angelina. Thank you for.
Yes, thank you so much. So let's pass the
thank you
floor
very
to
much.
Olga Karanets to continue with an overview through the International Data Space Association.
Good morning. Do you hear me? Do you see my presentation?
Yes, please make it to presentation mode.
Yes, it is presentation mode right now.
We can see the screen, which is on the slide mode.
Maybe it takes time to upload. Can you see now?
No, it might be. Do you have 2 screens, Olga?
No. No.
All right. Okay, just
Let
try.
me then do it again.
Great, thank you.
Can you see right now? No? Maybe it takes time for...
Nothing yet.
Yeah, 1 second, then I will do it in the different way to do it very fast. So here's the presentation. Can you see right now the full mode?
Excellent, yes.
Perfect.
Yes.
So it's just the settings. So I will stick to the 10 minutes. I guess this is the last presentation before we start the Q&A session. I would introduce International Data Space Association and basically the role of IDSA in the VELES project. What is the IDSA? IDSA was established in 2016. Basically, we contribute within 160 different countries. We have partners and communities. We have different hubs. We basically support companies within the building data spaces based on reference architecture model and IDS standard. As you can see, those companies are represented here, and we represented in 31 different countries. This is the core companies that help us to build the data space together and to share with you and with us the knowledge regarding to the building data spaces. Here on this slide, you can see the DSA hubs, competence centers, and labs, which means basically we have representatives in all of those countries who provide the IDSA standard and build the data spaces based on the IDSA standard. So what we bring to the table as IDSA? We basically provide the reference architecture model. Currently, it's the version 4, and we're establishing the next generation, version number 5. We provide the data space protocol to be able to share and consume the data within the interoperability standard. We provide the certification for the components of the data space. We give the knowledge sharing program. We provide some documentation which helps a company to build the data spaces such as rule book. And we also support with the knowledge sharing with the open repository where every company who would like to build a data space can look their examples, deployment scenarios, and implement the data space itself. Here you can see the core documents, which basically helps companies to build a data space, reference architecture model mentioned before, rule book, interoperability standards, and of course technical convergence within the DSBA Alliance, and also data connector report. Data connector report and one of the core documents of IDSA, where you can see the list of implemented connectors within the data space in different domains, including the health domain. Here you can see on this slide the design principles for data space, which basically helps us explain how to build step by step the data space. And just in a few minutes, I would explain what is this data space. IDSA database data space, this is the space where the data owner, could be data owner, could be data provider, would like to share the data within participants of the data space within the data consumer, who could be the end user as the data user. This data space sharing and consuming the data in the secure way within the interoperability, within the negotiations and contracting. Also, you can see additional components within the data space at App Store, identity provider, vocabulary, clearinghouse, and the broker. Those components are optional, basically. Here you can see the connector. What is this connector and why we need the connector? We need the connector to then the data provider would be able to share the data with data consumer. So both data provider and data consumer should have the data following the trust framework in the IDSA-based data space. Here you can see the schema, basically how all those components of the data space communicate between each other and share the data between each other within the protocols. And the data connector itself, this is the piece of code which basically certified by IDSA and helps data provider and consumer share the data within the security and the trust way between all participants of data space. You can see the data space protocol on this slide, which is the main core document of IDSA. So when we plan to build a data space, the first step we need to do, we need to look at the data space protocol and understand basically how to proceed with building the data space. In this example, you would see that 4 different companies already certified their connectors, and they propose it in the commercial way for other different projects and societies to be used in the future built data spaces: engineering, T-System, TNO, and VTT. All of them are members of IDSA. All those components that they were built are certified in the trust way. Here, briefly, I would not stop on each document, core document of data spaces, but I believe we would share this presentation and you can have a look at each of the documents peacefully. The data space for the Artificial Intelligence Act. So you should know that the IDSA is in line with Artificial Intelligence Act. Here you can see the semantic interoperability in data spaces, which also the core document that explain the semantic necessity. On this page, you can see the examples of the position paper in the energy industry who build the data space and provide their own deployment scenarios and examples. Interoperability and framework in the energy data spaces you can find also within this position paper. Reflection on DGA and data intermediaries. Very important within the changing of European law, IDSA is implementing and adopted European legislation. So you can be sure if you build a data space within an IDSA, it's aligned with European Union standards. This is one of the core documents which is published monthly, where you can find updated information about each component of data space, including the connectors. In the data space radar, we have more than 145 different use cases and projects already been built based on IDSA standard. If you are still interested in building data spaces, I would highly recommend to look at this document. Within the data space landscape, we explain basically how you should build the data space in different domains based on IDSA standard. Trust in the data space. This is one of the most core subjects in building data space within the test bed, testing the whole components within the test bed. We help companies to build the test bed. We offer deployment scenarios where you can simply take the open source code and implement it in your company. So I would not stop on those documents because it's already been explained. So IDSA role in the VELES project, based on information I gave you before, basically is within the two tasks. First, this is synergies with relevant EU initiatives. So we speak about the project with the relevant EU project and initiatives, and we support the VELES project and bring attention to this. And the second task we're participating in the VELES. This is the regional smart health data space. We're helping the VELES project to build the framework, methodological framework in different regions, which are represented with 4 different pilots in Greece, Cyprus, Romania, and Bulgaria. So as you can see, this is mainly all about my presentation. I would invite you, if you still have any questions, just please scan this QR code and follow the link. You will find the whole information on our IDSA website. About the future events, if you still have the questions, if you would like to know more about IDSA, just go to International Data Space Org events and you will find all events here. If you would like to become the member of IDSA, or if you would like to help us to build the reference architecture model version 5, if you would like to contribute in different working groups, please follow this link or simply click the survey. You can find out also IDSA member and partners. They taking part in working groups. So we create together with our members the architecture, certification, rulebook, and trainings. We teach people how to build a data space. We share the knowledge, and we write the whole core documents together with our members. We also ask you to be the pioneer in data spaces and join the IDSA within the member participation or without simple involvement within the donation, in working groups, or writing the documents.
Thank you.
Yes, I think this is all. This is the last slide about semantic interoperability. Thank you. If you have any questions, don't hesitate to ask.
Great, thank you. We heard from all our speakers today about health data spaces, and I'm sure they painted a quite complex picture. And implementing these health data spaces is not an easy task. A lot of different entities are involved. The International Data Space Association has been doing this work for other industries, other sectors, and is now active in health. I would like to start with some wrap-up. I will share briefly my screen just to have a view of what we discussed. You see, we need to analyze quite in detail about the SWOT analysis. What are the opportunities? What are the strengths? What are the weaknesses? And what are the threats in each one of these ecosystems? Building a health data space is not a straightforward action. So we need to have established knowledge. From what we heard our participants say, we need to establish knowledge. We need to, we have the opportunity that many things have happened in our countries already. But we also need to look at what common processes exist across countries. And from that, we have the weakness that we don't have quite good coordination. We need to have better alignment in all levels, from data sharing to governance. And finally, as a threat, it was mentioned by our speakers, the skepticism. A lot of skepticism about data sharing, even though we have technologically the mechanisms to do federated learning so that the data never leaves one organization. With this, I would like to open the floor with an open discussion. about how do you see this moving forward in your countries? And also, like Andy always wants to end with the conversation is, why is this important? So please, I would like to ask Olga for a brief statement, and then we will pass to the other participants. Andy, please feel free if you want to add
I'll
something.
ask this. I'm going to ask this very direct question. Okay, if I'm a 55-year-old man, I'm living in Yash, Sofia, Paphos, or Thessalonica. Why is this important for me? Why is this important for me about my health and my data?
Is this the question to me, right?
To all of you, to you, Georgie, Dimitri.
Absolutely. I would like to answer, I guess, the good point here would be why the European Union started work regarding to European health data space. Yeah, so currently we have different countries joining the EU, and of course the participants of European Union or European Union members, they basically travel a lot. Yeah, so we have like no borders between countries. Mainly, you can simply take the bus and cross the border. Yeah, but you are not secured. Of course, you are insured. Of course, you can go through this bureaucracy process applying to the insurance. But if something will happen to you in the bus or on the other country during the stay, yeah, I mean the health issue. So, and you will likely find a doctor who would like to make appointment with you, and you would explain exactly what are you feeling and what can you help you probably need. The doctor would not see any of your data, any of your health history. Might happen that the doctor probably will treat you in the wrong way. Yeah. So why we need the sharing and consuming the data within European health data space? Because the doctors would be able to see the history of your illnesses and your health story, let's say like this. Yeah. So you don't get wrong vaccination, you don't get medical treatment. The doctor would know your allergies, your specific of the health, and you can be sure at least that you get the right treatment in this case. Of course, it's very important within the e-prescriptions, which are also implemented as the part of European health data space strategy, because the e-prescription basically helps us to go to the Green Deal, to use less paper, and you get the old prescriptions on your insurance card. Yeah, so we avoid this paperwork and we save the nature. And in this global warming situation, we highly need it. That would be my answer. Of course, I can speak about it longer, but I guess that's more or less.
Thank you, Olga. Miles, would you like to make a comment about this?
Engineer talking to me?
Yes.
Yeah, sorry. Okay. I will start from 2000. The European Union actually, with funded European projects, national projects, they give money to countries, to member states, so as to establish their national infrastructure, exchanging the electronic health record. And top of them is the healthcare, the cross-border healthcare services. And now we have two services, and by the end of 2024, we will have the original PIGAN documents, the PDFs, etc. 2025, we will have the lab results, the imaging reports, and the images, etc. And by the end of 2030, something like that, we will exchange the complete electronic health record. But the European Union, based on the European health data space regulation, will push the countries actually to establish their national infrastructure so as to exchange nationally the data and then to the other European member states. So it's very important to support the mobility of the European citizens, but also we need the data so as to make our studies from all the sector, healthcare providers, pharmaceutical companies, and several universities, research organizations. So I think this is the big picture of the regulations and also the money that member states, EU countries actually spend so as to implement their national infrastructure.
Okay.
Thank you. Carmen? A comment?
Yeah, yeah. Some last comments. Yes, for us, it's very important for us, Imago Mall as an ecosystem, because we have been talking about digitalization in healthcare for so many years, and now we have some, a new regulation, which is of course very clear for us. But we have to bring all these new specific requirements very close to the healthcare providers, to the patients, to the academia, because we are somehow in our own bubble, of community and sharing community and learning community, but the others really don't know what is all about this new regulations. So this is our role, to make them understand what is in there for you, what are their advantages. And of course, you see people, they want to share their data, but they share it in an unsafe way. Or there are people who don't want to share their data because, it's not legal. They're not sure that they don't do it by breaking the law, related to the health data. So this new regulation will help us all, to have some really clear rules on sharing the data. And here is our role to make it understandable for our
Thank you, Carmen.
stakeholders.
Very clear. Dimitrios.
I will start by trying to answer Andy's question, because in order to build effective decision support systems and, of course, artificial intelligence models, there is a need to have access to a big amount of data. So this is why it is very important. And in order to innovate and deliver at the end of the day data-based digital health solutions in a manner that will make our health systems more sustainable, you need to have a strategy, and you need to overcome a lot of hurdles in order to accomplish that in the process. Building health data spaces, as all of you have mentioned, is not an easy task. It requires coordinated steps, and it requires one of us learning from the experience of the other. So this is why we need to build excellence hubs like the VELES one. And one thing that I have to say and conclude my position is that innovative SMEs, those companies, those startups that really make the difference and provide the good ideas, it is very difficult for them to be involved in public procurement as direct suppliers. And I mean in projects like the ones that we discussed earlier, the ones in Greece and the ones in Romania, for example. So it is very important for us to take as a take-home message, let's say, the fact that there is a need to develop in our own countries, within our countries, some joint strategies between the people that are responsible for delivering healthcare services, that is the Ministry of Health, for example, and the people that are responsible for conducting research, innovation, and supporting businesses to develop, because the perspectives of each one is different, and sometimes it's not aligned. So that's I would like to convey as a message. There is a need for joint strategies, both within our countries and also across our countries at a wider European level.
Andy, do we have a few minutes to hear also Georgi? And I know Dimitris would like to
Always
say.
got a couple of minutes to hear from Georgi, and I think we've also got Dimitris with some. Because what I'd like to better do is after you hear from Georgi, there's other projects that do the same similar stuff. So how can we connect some dots? You think about all those dots that are behind Angelina's head there. You can see it.
Yes.
How can we connect some dots between the VELES project, the digital health uptake project, and the XShare project? So Georgie, yeah, come on. Tell me about Bulgaria. Why is this important in Bulgaria?
Everything is important that I listen today, and the most important thing for me is to build and because we are on a way to build independent national healthcare record, and we are very close to this. So most of the things are already paperless, all the recipes and all the prescriptions and everything. But still, the problem is how we can use this data. For example, for research, but even for decision making. It's not clear because we have some problems in the regulation still, and I think that our pilots in the VELES project will play a really important role in this in the change of the legislations, with thinking about making much more easier all those things without, of course, making any compromises with the security of the data, etc., etc.
Mm-hmm.
That's it.
Okay.
Thank you.
Thank you.
Let's hear now
Dimitris.
from Dimitris.
Thank you. I think you see my screen. So I just want to add to what has been discussed, that Excel project is a 3-year Horizon Europe project that envisions everyone sharing their health data in European electronic health record exchange format with a click of a button. This button would be the Excel yellow button, and it would be featured across health apps and portals, allowing citizens to easily access and share their health data for primary or secondary use. We have the project started in January. We have 8 adoption sites. Greece and Cyprus are 2 of them. ECH Alliance, the National Health Authority of Cyprus, Fourth, and Gnomon are part of this project, and we invite you to join us and follow us on social media or subscribe to our newsletter in order to be updated with our news for the next 2 and 3 years.
So lots
Thank
of
you very
dots
much.
to connect here. Angelina, anything else from you?
No, that was great. That was very comprehensive, and we have a clear picture about what's going on in the Southern Eastern Balkan area, and I'm sure similar experiences appear throughout the world. So Andy, was great to be with you.
Yeah.
Please have the final words.
Well, I tell you what, this is really encouraging, because you're saying this is happening across the world. It isn't. Okay, so what you're actually seeing in Romania, in Bulgaria, in Cyprus, in Greece, okay, is something that other people are they're so fixated with old existing regulations and rules. You're just getting on with it. And that to me, because as you can imagine, I don't have a lot of patience, okay? And I think there's a great example where you are actually taking a lead role with this, okay? And many people say, oh, no, Greece is going to be really complicated, or Bulgaria is going to be miles behind this, or Romania, where they can, well, you've actually done it. So I think there's some really crystal clear examples here where you've got these health data spaces moving, because it is really hard sometimes. I play hard to understand with most of these things, but you've actually got on with it. And I think sometimes for impatient people like me, that's half the answer. So let's make sure we connect some dots up between ourselves Okay, it's good to see so many of our ecosystems and members taking part in this today, and all our project partners, because there are so many dogs. So I'd like to thank colleagues from the Hellenic Digital Health Cluster specifically for being behind organising this, colleagues from the VELES project for taking part in this, many of our colleagues and members for presenting today. It's been fantastic. We've seen some great opportunities. We'll be recording and sharing some of these presentations and serving them up on social media for people who watch things on Catch Up TV. And hopefully I'll see you all in person very, very shortly. But thanks for coming along, and thanks for taking part.
Great. Thank you so much.
Thank
you,
you.
everyone.
Thank you.
Thank you.
Thank
Thank you
you
very much.
Bye.
Thank you. Bye.